Good afternoon, everybody. We are almost done with the workshop. Can you believe that? Some of us started 8 o'clock in the morning. All of you joined at 8:30, and now in next but 12-15 minutes, I will quickly give closing remarks, and then we can call it a day. So let me start with my thoughts and closing comments. Just three broad categories. I want to acknowledge a lot of people who have worked very hard to make this workshop such a success. I then want to try and capture in the workshop highlights, which in a few minutes, which is going to be a very tough task. And then in a slide or two, next steps, what we think, what our plan is regarding the proceedings of the workshop. So with that as a background, let me go into starting to thank people. I want to start by acknowledging my co-chairs, Jim Pauly and Paul Sue. They have been so wonderful to work with, and we started as a concept almost a year ago, and then we developed it. We had to clear that through FDA and CERC clearing committees for this to become a topic that will be supported through FDA and MCERC. And then once we got that sorted out, and then developed the full agenda, and then worked with so many of our friends and all the experts in the area to put together the topics, speakers, format, and again, we usually don't have breakout sessions in these workshops, but thanks to Paul and Jim, we were able to develop that and then implement it. So thanks a lot, Jim and Paul, for your support. And I can't thank enough the MCC colleagues, Dana and Anne, and then sorry, a couple of other colleagues that I missed the names on. Jim had them at the beginning of the workshop, but their technical support and their level of expert handling of this workshop is so amazing that we saw hardly any glitches for the entire program, and switching people into workshop, breakout sessions in and out, and then maintaining this level of connectivity is not a small task. So, and to me that went so smoothly. So thank you very much, Dana and Anne and other colleagues from MCERC. Our FDA project managers, Tracy and Althea, they also were key in bringing the program together and moving it forward, keeping it on track. So Tracy and Althea. Then all the speakers this morning, in all 8 of them, can't thank them enough. Utpal, Donna, and Haritha from FDA did a very nice job in providing FDA perspectives, and I'll share a bit more highlight in my next few slides. Jack Cook and Ravi Shankar from Pfizer, very informative presentations. Katja Christian and Bergink, I hope I said it right, from Sandoz, and then Sid from Absorption Systems. And of course, you can't thank Jenny Tressman enough with her almost like keynote presentation on the future of permeability. Then moving to the panel discussion panelists, I really want to thank Jan Wellink from EMA, John Gordon from WHO, and Shirini Veerasingam from Health Canada to join the speakers and then share their very insightful and unique perspectives from each of those organizations. And Paul CEO was working behind the scenes to make sure that the panel discussion went smoothly, and he was coordinating with Jim on moderating that panel discussion. So thank you, Paul. And we just got done with the 2 wonderful breakout sessions, which were co-led by Donna and Yu Chung. first session. Second was Jim and supposed to be Pablo. At least the one I attended, I had Jim and Jack Cook as the co-leads, and then Shirini and Susanna. We just got done with that session, which I was in the second round. So thank you to all the co-leads. And then each session had a scribe, which is Harita for session 1, Jaya for session 2, and Danika for session 3. And the reason we had scribes, I'm going to say that a bit more towards the end. But big thanks to the scribes also. I do want to acknowledge Jim separately and specifically for he has worn so many hats, for this workshop, in running the workshop, moderating the panel, co-leading the breakout session, lining up expert logistical support, bringing the entire MSRC apparatus to, help implement this workshop. So Jim, thank you very much. And then last but not the least, all of you attendees, you're still here, and you really participated very actively, especially in the breakout sessions, and those have been captured, and we really thank you for attending and sharing your viewpoints. Now, again, don't have enough time to do this. It'll take hours if I did justice to everybody's presentation. But my quick one or two liners takes on each presentation. Utpal, thank you for a very concise overview of M9. Very informative. Then, of course, Jack's revealing take on permeability, M9, and wishlist. Jack, you mentioned it, and I do want to say that those trumpets on the M9 slide were very good to see, as well as your perspective on epiphanies on permeability and your wish list regarding the solution you want, and we heard you. Katya's, both the Katya's, very informative presentation on red perfusion model results, and that's something that we'll be keeping in mind as we move forward. And then, of course, Ravi's like 30,000 level view on permeability, solubility, and then the real struggle, the challenges that the global companies, the innovators face in global filing of their applications, and how to what extent BCS is utilizable there and to what extent it is not, which was very informative to know from innovators' point of view. And again, Sid's presentation was really informative. I found it very informative and educational, and I hope all the attendees, especially from the generic industry, would have found that useful. Also, in terms of discussions or exchanges of with FDA in resolving specific review aspects of KECO2 method validation. And I was very intrigued and excited by seeing that approach, the IDAS approach, which I hope bears good fruit and good results in the near future for us rationally expanding, having the ability to expand excipient aspects for BCS class 3. That would be very nice to see, and I'm very happy to see that work being supported by FDA. Donna, I can't thank you enough for your excellent KECO2 method suitability overview, and I'm sure our participants really appreciated that overview. And Rita, again, excellent presentation, very informative examples and things to pay attention to when filing an application. I'm sure it was very well received. And then, of course, the closing presentation by Jenny, such an exciting overview of the future of permeability measurement. I am really excited by that e-pill that project that she and her colleagues have been working on, and wish them best of luck. And I do hope that in the near future we see its utilization and in a generation of very good, informative, comprehensive data. Then again, I mentioned briefly about panel discussion, but I still want to say a bit more here. Yan, thank you very much. Yan, John, and Shirini, you really brought your, your agency viewpoints in addition to what we had to offer from FDA. And I would like to believe that our audience found that this was a really, multi-regional in exchange of information, information sharing from different agency perspective, and I'm sure everybody found that very useful, very helpful. So appreciate that. Then finally, coming down to the breakout sessions. Again, this was sort of a bold idea, but we implemented that, and to me, all three topics were very exciting, very relevant, and I was able to attend only two of the three, which I found the discussion very very useful for moving forward in this respective areas. So the first session we talked about in vitro and in silico intestinal permeability methods. And again, at the beginning of the session, Jim had this more details about each of these breakout sessions, but here the objective was to identify permeability assessment methods other than the KCO2 and how to validate methods. And I couldn't attend that, and I'm looking forward to the summary of that session. But I did attend the second and third sessions and found those discussions to be very informative, which was excipient effects on permeability and what we need to be concerned about. The objective was to identify excipients that do not need to be Q1N or Q2 in various situations, including any limits on excipient amounts. And again, very robust discussion on this session, as well as the last one, which was use of label and literature data to designate permeability class. An objective here was to identify label and literature data types that can serve as primary data to classify permeability as high and requirements to be met. And we did have very invigorating discussion that just got done. And thank you again, Susanna and Shiri and Danica for managing that session so well. So this is, I'm just getting close to finishing my quick closing remarks. But next steps, I'm very serious about this, and that we do want to publish the workshop report, and hopefully very soon. And to that extent, we encourage all the participants, rather all the speakers, and everybody else to do their share. And several of them have already submitted their presentation summaries. Others are working on that. And that was the reason we had a scribe. And again, I have to thank them for volunteering their services. For each session, we were able to allocate a scribe to capture notes. And so that all is going to be put together soon, and then we will bring out the workshop report. So hopefully that will come out soon, and people will be able to have that as a document to refer to. Jim did mention this at the beginning of the meeting. Just want to repeat that recordings from the morning, afternoon session, and this is my closing remarks. Those recordings will be made available within about 3 weeks after the workshop, so attendees will be able to access that. And presentations will also be available once the speakers have given their approval, and if they needed to make any final change. So vast majority of the workshop recordings will be made available. We are not making recordings or slides available from the breakout sessions, but as I said, we have taken extensive notes. Each session, co-leads and the scribes have taken notes to capture the discussions in those sessions as well as they could be captured. So, and then that'll be part of the workshop report. So people will not miss out on that. We did not want to record this live exchange of views and ideas in order to just make sure that everybody felt comfortable participating. So with that, I want to thank you most sincerely for your time, your energy, your dedication, your concentration, and your contribution to making this workshop such a success. And wish everybody good luck in BCS implementation, and hope to talk to you and engage with you in the near future. Thanks, everybody. This concludes our workshop. And Dana, if there's anything that needs to be done, otherwise you can end the session. Thank you.